Hello, gorgeous! Welcome back. Today we're diving into a topic that hit close to home for many of us, acne. You know that annoying, sometimes painful skin issues that seems to show up right before big moments? Like when you're all set for the shine. Just a month ago, I was in Toronto. I had a stage pitch, prepared for tirelessly. My outfit, my hair, every detail, my makeup, it's all planned perfectly. I was feeling confident, ready to go. But then, as I giving myself the last look in the mirror before bed, you know what? The little red bumpy thing starts. And it's right here. Like it knew it was the worst possible moment to be there and to be there. I tried everything. I ice it, I try concealer. I even search online and dab some toothpaste for it. It was like 2 a.m. I Google searched it, but it wouldn't budge. All night, I couldn't sleep. I couldn't stop thinking about it. And the next morning, instead of focusing on my big day, all I could see was, I'm not perfect. And you know what? Everything plus the stress, somehow, it just knew. It just there. Every single time. And you know what? It's everything plus the stress. Somehow, it just knows. Dealing with acne can be a real challenge, and while medical aesthetic treatments are tempting, it's important to remember not all treatment works the same on everyone. Your unique skin type and genetic plays a huge role in treatment effectiveness. And let's break down the options and what might work best for you. To start, let's get familiar with the types of acne out there. Now let's take a look at some common medical aesthetic treatments for acne and how they work or the potential side effects. Intensive pulse light IPL. They use light to target acne-causing bacteria, reduce inflammation and boost collagen for smoother skin texture. Expect possible redness and swelling from it because it's heat, right? For darker skin tone especially, there's a risk of hyperpigmentation due to melanin response, often linked to MC1R genes. A study in dermatology research and practice highlights that patients with darker skin had higher chance to pigmentation issue without a proper assessment. Take my friend Lisa, for example. She has those beautiful sun glow, sun kiss type of skin. She likes to sunbathe. However, when she decided to do the IPL treatment for her acne scars, she heard that it could help even out her skin tone, so she was excited to see the result. But a few days after her section, Lisa noticed dark patches forming around the treatment area, which keep getting worse. When she went back to the clinic, she learned that her skin, its natural melanin response linked to her MC1R genes, make her more prone to hyperpigmentation with the IPL treatment. Lisa's experience is reminding to always check with your clinic about how treatment might interact with your unique skin tone, especially if you have more melanin. Take that extra steps can help you avoid unwanted pigmentation and make sure your result is what you want it for, right? Let's talk about laser treatments. Fractional CO2 laser targets deeper layer to reduce scar and prevent future breakouts. It's smooth-skinned over time. The common side effect including redness and swelling as usual. For those with keloid tendency linked to COL1A1 genes, there's a risk for abnormal scarring. One case study in dermatologist surgery reported that hypertrophic scarring in a patient with a keloid predisposition. Now let's talk about chemical peels. Chemical peels use acid to exfoliate, clear clogged pores, and improve skin tones. Let me tell you a story about my mom. A few years ago, one day she heard about this treatment called chemical peels and it can brightening her skin tone. She was so curious and so that decided to give it a try along with my aunt. The idea of fresh, glowing complexions sound amazing. But after her first section, my aunt were okay. She looks fabulous. But my mom started to react on intensively than expected. She experienced those redness with the peeling area and lasted much longer than it should be. Then she went to the clinic and see our derms. After talking with our dermatologist, Michelle, we learned that her skin barrier functions likely influenced by the FLG genes variations make her more sensitive to acid in pills, resulting prolonged irritation, of course. My mom's experience taught me that, especially with the treatment like chemical pills, knowing how your skin naturally barrier functions make all the difference in avoiding prolonging recovery and discomfort. Next, let's talk about microneedling. I mentioned microneedling last time in my hair follicle episode. Microneedling is creating micro injuries to, hurt, to poke your skin, to boost collagen, to improve the texture and tones, especially working good for scars and large pores. Redness and bruising are most common post-treatment side effects. For those with family history of psoriasis, microneedling could trigger flare-ups. They often linked to HLA-C genes. Studies show that individuals with a genetic predisposition to inflammatory skin conditions may experience worse outcomes. I've tried it once with my technicians. Always told me that it can get rid of my pimples and scars on my cheeks. Of course, I've been so. Same story for my mom happens on me with this treatment. Like mother, like daughter. Last but not least, steroid injections. These quickly reduce inflammation like cystic acne, providing rapid relief. It's very good for, on-stage time. Prolonging use of it can lead to skin thinning and discoloration. If you have genetic tendency towards skin atrophy related to collagen production, proceed cautiously. The American Journal of Clinical Dermatology documented severe skin thinning in a patient with genetic susceptibility. It's crucial to address common misconceptions about acne treatments. Many believe that harsh treatments yield better results, but overdoing it can lead to irritations. A consistently gentle skincare routine often works better. Plus, lifestyle factors like diet, sleep, stress are huge in managing acne. Balancing diet with vitamin C, E, A, omega-3 supporting skin health. Remember, our skin is unique, and tuning into a signal is the key to effective treatment. So what's the takeaway here? Not all acne treatments are one-size-fits-all, and your genetic heavily influences your response. Personalized care is essential before committing to any treatments. Consult a knowledgeable dermatologist who consider your unique genetic makeups, skin types, and history. Thank you for joining us today. Don't forget to like, subscribe, and hit that notification bell for more skincare insights. Until next time, stay fierce, stay fabulous.